The kind of research I do is pharmacoepidemiology. So that means looking at drug use in a large population. I take data from the National Cancer Registry and from the medical card data collected by the HSE. This information tells us about the type of tumours that patients have and also what kind of medicines they were taking for their regular conditions like heart disease or diabetes. So my research is in diabetes, and I look to see what drugs people were taking to treat their diabetes, and I look to see if there were differences in their cancer outcomes depending on what type of medication they were taking. The idea behind this research is that the kind of medicines we use for a lot of regular conditions, they could be useful in cancer also. So we try to explore these. A drug like aspirin, for example, we used to use it as a painkiller or a hangover cure. Now we know that we can use it to prevent cardiac disease, and also it may be useful in cancer. So I'm looking at diabetes drugs to see if certain drugs are better or worse than others and how they might benefit people who have cancer also. We're very lucky in Ireland to have access to the National Cancer Registry data because this is excellent information on types of tumours and issues that could affect the results. So instead of just going to one hospital and collecting information on some patients, I have information from patients all across Ireland. So because I can use that data and because I have the support of the Irish Cancer Society to do this research, I'm able to produce research that would be regarded as very robust internationally. There's currently clinical trials ongoing at the moment. They started while I was in the middle of my PhD. So they're looking at the drug that I'm studying, that is metformin, in breast cancer now in a very large clinical trial in Canada. They're also looking at using metformin in colorectal cancer, which I'm studying, but they're not looking at examining survival just yet. They're just looking to see effects on tumour production. I think this type of research that we're doing is very important because, as I said before, we're not looking at drugs that are particularly toxic. We're not looking at very expensive drugs. We're looking at very commonly used drugs that could have very interesting and very important effects in cancer patients. It's research that is quite easy to conduct, but does need the funding to make sure that we have very rigorous methods and that we continue to have the access to the data that we need. But this type of research, for a small investment, can generate a huge return in that you can see they've already gone into clinical trials with these drugs. So it could have a big impact on patients in a very short amount of time. So it's quite exciting.